Incredible to see friends in this setting, and we've been having a very wild adventure together for the last few months. We're going to do something a little different today. We're going to talk about an experience that we've had. You're used to hearing me talk about homelessness and healthcare and the nexus and how it affects our systems, but we had a special experience that I wanted to share with those of you who weren't directly a part of it, although I'm staring right at one of my partners in crime and dearest friends. Nadine, stand up, because she was spearheading this medical mission. It was incredible. People like Nadine, people like Mufi Hahnemann, who stepped up and said, I can put you in touch with the right people if you guys are willing to go and save lives, did that. We're going to talk a lot about how this medical mission came together, but I wanted to start by saying, it is incredible what capacity you have. This was a lesson I learned in a very short period of time, although we've always sensed it. When we bring our healthcare professionals together, when we bring our health systems together, like the Healthcare Association, Queens, HPH, Kahuku, and we take on a mission together, and I'm not talking about a religious mission, because I'm an agnostic Jew married to a Mormon, okay, so I got issues at home. I'm talking about a health mission. It is extraordinary what we can accomplish, because we often talk about how difficult it is. We're healthcare short. We don't have enough providers. We don't have enough resources. But my goodness, when an opportunity arose to help a lot of people all at once, man, did Hawaii step up and really made an incredible difference. So I'm going to talk about that today. So, accidentally became lieutenant governor last year. Thank you guys very much. Yes. That's proper attire, improper attire. The nice thing about being lieutenant governor is no one has any idea what to do with the lieutenant governor, which means that I can do medical missions with you guys. And this is how we've started. I mentioned this because if we haven't spoken before, it's been a weird road, and a lot of us are on a weird journey in healthcare, in my opinion. Mine started in India, where I decided to be a doctor. I saw people suffering, and then went on after medical school to Swaziland in South Africa, and saw, again, crisis after crisis after crisis. And I'm mentioning these things today because when we were in Swaziland, the HIV rate was 56%, and we had no medicines, because the medicines we flew over were taken from us and sold in the black market. And we saw some pretty extraordinary things in that country. And that was on my mind very heavily when we were recently asked to come and serve very briefly in Samoa. Some of the rest of the journey was the National Health Corps, which brought me to Ka'u, and I was happy to see a friend today who also did National Health Corps to do loan repayment, things that Beth and I fought for years. Ways to give back in healthcare, and now I'm seeing it from the other side, now that I'm so-called wise, which is really just to say I'm 50 in a month, okay, so older. Not wise, but just seeing it from the perspective of what we can do as independent physician groups and hospitals, and a little bit of this emphasis from Lieutenant Governor's position, but what we can do as healthcare providers when called upon can change the world. So serving as Lieutenant Governor now, and what we decided to do was to make it a humanitarian office. That's it. Because I really have no political power whatsoever, but I do have the capacity to bring people together. And people ask us all the time in my office, could you do this? Could you do that? Well, it turns out if you answer yes on occasion, something serious just might happen. Sometimes we're just handing out rice. That was Chad Buck donated truckloads of food for people. Things are out of sorts right now. There's a lot of poor people here and in Samoa and in American Samoa and in Micronesia, all across the Pacific. Incredible need, but we have capacity. Please don't forget that. That's us in a homeless camp, I think up on the North Shore, if I'm not mistaken. So we bring people together, and we're seeing it work, but we had a weird experience. So just a few weeks ago, after doing these things, some of the mundane stuff, and on the streets, I think Dr. Koyanagi and I were there on the street talking to a woman who needed mental health care, we realized that we had more capacity than we were offering. And we had decided we might do a little bit of support. I was watching the news like everybody else, And we saw that children were dying in Samoa. And so I called up Mufi and I said, Mayor, what could we actually do? Could we get in touch with the leadership there? And he said, you bet. So we were going to do a small mission. Just basically 5 of us were going to go over, take 5,000 pounds of material goods, emergency medical services and whatnot, and on the phone, setting up a basic small mission just to help out a little bit and go and see what people needed. And while I was on the phone this was a very strange thing, while I was on the phone with the Secretary of Health, in the background, you could hear the Prime Minister shooting his mouth off. And pretty interesting guy, the Prime Minister, and he said, you could hear him in the background, I'm shutting down the country for 2 days. We're going to immunize everybody. And the Minister of Health comes back on the phone and says, hey, I know you were going to send 5 people. Could you send 75 people? And I said, well, I don't think so. What are you talking about? When? I mean, maybe in a couple weeks, do you mean? We try to get, he said, no, on Thursday. This was Monday. The problem with that is it's across the date line, so it was just actually Wednesday that we had to get there, 30 hours later. And so I said, well, I don't know what we can accomplish, but we will try. And so we said to the gentleman there, we said, we will reach out. We'll reach out to the people of Hawaii because he explained they're having a crisis. There were already 60 dead. In Samoa, I don't know how many of you knew the backstory, but they had gone through a crisis. 2 children died at the hands of a medical team, certainly not casting any aspersions. 2 nurses in the field had accidentally immunized 2 children with the wrong reagent. For those of you in healthcare, they had used a paralytic agent and it killed 2 young babies. And they immediately shut down their immunization program 2 years ago. So they dropped to 33% immunization rate. And you know what that means. 33% in your country, if someone sneezes, everybody gets what you got. In this case, it was measles. And to add insult to injury, and again, I'm not judging too much, although I'm kind of on my soapbox on this right now, the anti-vax community came in and scared the hell out of everybody. Using the internet, using Facebook, coming into country and speaking to the Prime Minister and saying, look, you're killing people, look what happened. Well, it was a terrible tragedy, and those people went to prison for a time. But it was so tragic that now the country was completely unimmunized. And with 60 deaths and 4,500 cases of measles, they knew it was going to take over the whole country if something didn't happen. And they now had an announced mission that they were going to have to immunize the whole country in 2 days. 200,000 people live in Samoa. For those of you who are not spending a lot of time in Samoa, sometimes people say Western Samoa, but it's Samoa, as opposed to American Samoa where there's 60,000 people. So there's Nadine. I said, Nadine, you're short, and you constantly whisper. Stand up, please, on this chair and tell people what we're about to see. Tell people what it's going to be like when you see advanced cases of measles. Tell them what it's going to be like when you have high fevers and we have only limited access to health care. So we called together the team. That night, we said, we'll go on TV and we'll ask for some support. We thought maybe we could get some volunteers. 12 hours later, we had 480 people from Hawaii. 480 people reach out to us, just through word of mouth and one quick little TV spot, I think, on Hawaii News Now. People were calling, I'm going, I will go. How long do you need me? They didn't know if we had plane tickets. They didn't know if they had to be immunized. They didn't know if they were going to be there for a week or a day or what. And they just said, if someone's struggling out there and children are dying, we're going, which really kind of encouraged us, we got to get this done now. So we began to gather supplies. Mind you, we had 30 hours to plan the whole thing because we knew a lot of things. We knew kids were going to die. We knew that if this became a bigger crisis and it hit New Zealand or Australia or the shores of Hawaii or back in Ka'u, where I practiced for 4 years in the National Health Corps, where the immunization rates are quite low for a lot of these different illnesses, we could have a crisis here as well. So we culled down that list. We would have loved to take more people, but we didn't even know if we had a plane yet. We found out who had passports, who had immunizations, who had titers. A lot of people scrambling, I can tell you, to get titers, and Nadine was writing, she sent me to go get a freaking titer, even though I convinced her, I thought, that I had been immunized. And we went on the plane. We scheduled a plane with Hawaiian Airlines. We said to them, we don't have money for 75 people to fly. They said, we'll give you a plane. Now, at first I thought it was a plane there and back. We only had a plane there. Which was a bit horrifying halfway through the planning, as I told Nadine and Scott, these guys, whoever you are getting to come volunteer, we're going to get you back home. So then we called Fiji Airways, and we said, we're going to have people there in the island on Samoa. Can you get us back? And they said, well, we have 71 seats. We'll fly you back for free. We'll bring whatever we need to bring back. A lot of interesting stories. I'll tell you some of the funny ones. The Fiji Airways, they first had 71 seats. Then they oversold the flight after they gave us a seat. So then we had 12 seats too few. But I had promised the Hawaii Pacific Health, where's Michael? I promised the Hawaii Pacific Health guys I would not leave anybody in country. And he had a team of 12. And I was thinking, oh man, I'm going to have to tell them they got to fly back to Australia or New Zealand and then over. But people were so impressed by the Hawaii delegation that they had volunteers far in excess of the number of seats that we were short that agreed to fly the extra 18 hours to Australia and then over to Hawaii in advance of their vacation so that we could all fly back together. Incredible in every way. And then, just when we thought it was going to cost Hawaiian Airlines, I think it was $300,000 of fuel, Par Hawaii paid for all the fuel. They said, if you're going to save kids, we're paying for it. So one after another, Healthcare Association, Queens, HPH, everybody. So off we went to Samoa. We spent 10 or 12 hours on the phone convincing people that we could do this. This was an interesting situation too, because I said we need medical licenses to the Prime Minister if we're going to go practice. And the Prime Minister said, well, I don't think we can do them in 4 hours. Why don't we just suspend all laws? So that worked. If you want a medical license, man, go to Samoa. I'm telling you. In fact, little known fact, our team from Civil Beat, Star Advertiser, and Hawaii News Now were also medical providers for the trip to Samoa. That's a true story. So we got together. We got on the plane at 2 in the morning, and we decided the best thing to do was to fly all night. Now, one of the challenges was Hawaiian had been in a spat with the government of Samoa over, I don't know, business stuff, right? But once again, we knew that we couldn't fly into American Samoa and lose 6 hours because we only had these 2 days. Now, mind you, the Prime Minister has said, we're going to shut down the country to immunize everyone. But how can we do it if we have to stop first in American Samoa and come over? We couldn't lose the 6 hours. So we got special permission to land a Hawaiian Airlines plane in Apia in Samoa. And why is this challenging? So these are the nuances of trying to do a medical mission with no preparation, not knowing what you're doing, although we learned a lot. Because technically, I got a call from the CIA sometime during this is a true story. They said, please be aware, if you guys go over as government officials and you land in Samoa, it's a foreign incursion, and you will have invaded the country of Samoa. So we need to have documentation from the Prime Minister or Secretary of Health, Minister of Health, that you're allowed to come in and you're welcome. And so I said, I called, I texted, I said, Prime Minister, I'm told that we are now invading your country. Can we have a letter, please, welcoming us into Samoa? Because we're going to fly in at 2 in the morning till 8 in the morning and land. And of course, next thing, 4 minutes later, this will not be considered an incursion into our country. We will not be in a state of war. You're coming to vaccinate everybody. Awesome. So we flew all night, and we landed in Samoa, and there we were greeted in Apia, where there were already 55 dead children. 95% were under age 4. I think it was all but 2 or 3, if I'm not mistaken, were under the age of 4. And on that day, I think there's the number, 3,881 cases reported. We had these 76 doctors, nurses, staff team fly in and land. So people were sleepy and excited at the same time. We knew we had to hit the ground running because Samoa had this very limited window. Now this is where it started getting extremely interesting. This guy, he's a Russian expatriate that now works in the World Health Organization, was there. There's also a guy named Sean in some of these pictures, fabulous people. coming to us this Friday to work with us, he explained what we were really up against, which is we were going to go into villages where they had been traumatized recently by this outbreak. And we were a very foreign group, and we had to integrate immediately into a foreign medical system and make sure that from an anthropologic and sociologic standpoint, we were very thoughtful and we were part of their system, not they a part of ours. And that advice made all the difference, because I will tell you from my standpoint, we didn't have a single patient say, please don't give me that immunization, or I don't want to have the experience of seeing your doctor or your nurse or your PA or anybody, not one in a whole country. And we immunized 33,997 people in 2 days. It was unbelievable. So this is what it looked like when we landed. There's Nadine looking at this prime minister like, what are we into, Green, here? He welcomed us and rallied the troops. Now, I'll tell you some stories about him. The way they set us up was there were 120 vans, obviously driven by Samoans. They were not going to let me or Nadine drive these cars, okay, across the country. The prime minister has shut down the country. And in order to get everyone vaccinated, nobody could move around. Now, you can do this in some countries. It's difficult to do this like here in Hawaii because we don't ever listen to government, which is probably smart. There, he shut down the whole country. And he did something fascinating. He said, we are going to ask every person who is not vaccinated in our country to tie a red sash or ribbon or towel or something red around a post at their house. Now, I don't know how many of you guys are Old Testament types, you know, but this guy was, okay? And it came out in a press conference, which I think I may have a picture of coming up. So you guys know, I know Beth Ann knows this. We're like the only 2 Jews in all of Hawaii, okay? If you're in a crisis, okay, and this is the biblical part, and this was a biblical crisis, right? Because their whole country was going to be infected without any hospital services per se, or very limited. If you put a red sash or a red mark on your house, what that means is you're asking the angel of death to pass over you. And that's been used historically as a sign that you're seeking help, or that you're seeking spiritual help or support from above. In this case, you actually want literally an angel of death to pass over. And that was what he meant. And no one was talking about that because they're like, okay, you're just putting the red thing on there so they can go and immunize everybody, right? He actually meant the angel of death, because I was sitting in a press conference with him in the night in between. And I'm sitting there tired. We've been flying all night, or, you know. And he sits across from the New Zealand press corps who hated him because they had had a thing. And I'll refer to this guy as Jerry. I think his name was Jerry. The New Zealand press guy says to this prime minister, he says, you killed all those people, prime minister, by not immunizing them, and now you're doing it, so kind of bad on you, good on you. And the prime minister, this is apropos of this angel of death thing, says, Jerry, you are corrupt, more corrupt than even me or the lieutenant governor. And I was like, dude, I'm just here immunizing people, okay, that's it. And he says, no, Jerry, you are corrupt, and we are in the Garden of Eden, and we are Adam and Eve, and you are the snake, he says to the press. And this guy, poor guy Jerry, is like, what the heck is happening? You know, the prime minister just called me a snake for covering the fear tactics and the immunization crisis and the epidemic. He says, you are the snake, Jerry, and you are on the take more than even I am on the take. And I don't know what he was talking about, and Jerry doesn't know what he's talking about, the prime minister. The prime minister is really on his dignity now. And he says, Jerry, I saw you exchanging money with Frank on the corner right over there this morning. You were on the take. You should give us only good coverage. And Jerry says, Prime Minister, I was just buying gas, man. I was giving this guy some money for gas for my truck. I wasn't exchanging money. And they went back at it. And this is what it was like in the dialogue as we were trying to immunize a country. But this guy was citing the Bible, because in that country where he was seeing hundreds of people, all of whom are in very tight families, in clans, in tiny villages, have mortality rates, acute illness, and then 3% mortality rate instantly devastating. So there we were, getting our briefing, and then the prime minister would go away. and just send us off with these teams. And this is what it looked like in the villages. People just came, one after another. And we would get to a small village, and you'd see what's called a fale, which would usually be just like an open home. I was there with some of my dear friends who are from my team, my security team, who are Samoan. So they could speak the language, and just a wave of people would come out of the village, or out of essentially the jungle, and get immunizations. And there we would stand, and we would immunize, and then an ambulance would go by. And they would be rushing to a tragic case that someone now had a fever of 104 and was collapsing from dehydration. Made more difficult because people were told to stay in their homes. But there we were. We would walk into a house, and this was probably the most poignant moment. Nadine and I were in a village, and one of the older gentlemen, the patriarch, said to us, the baby over there is sick. And it was just down a little path, and so we kind of raced down the path, and we put our hand to the baby's head, who was in bed, and the baby was hot, with a screaming fever. And then a moment later, we immediately examined the child, and the child had just passed away, but was still hot from the fever. And the process then was not what we would normally experience at CAP in the ICU, with a code, with all these things. The process actually was, we took a moment to leave, we went and collected money, we gave an offering for a funeral service, and then we embraced the mom, and then we immunized the 6 or 7 children that were the siblings that were obviously exposed to the measles and unimmunized, all in a 20-minute cycle, and then went to the next village or the next home. And it was like that for 2 days. But you can see, look at the looks on people's faces, though. It wasn't an experience of tragedy. It was actually an experience of kind of joy in a very unique way, in ways I don't know, even I understand yet. There was some definite trust that was, I think, translated because we don't want to be too much like this, like a Western medical team that had come to be supportive and respect the host culture, but they had had a crisis with their own providers, so it helped. It helped restore trust immediately in just 2 days. So imagine what we can do when we come together as a healthcare system in 2 days. Imagine what we do in 2 weeks or 2 months or 2 years if we commit ourselves to solutions like this. And there's Dale, for instance. He was so excited to be out there, out of Hawaii Pacific Health, out in the field. It was just one kind of joyous experience after another. And I'm not even counting the beer tower that we bought in the night in between. This is, I think, the most beautiful boy I saw. So I think he lived. I think Nadine and I talked about it quite a lot, because we knew he had measles. And he was just sitting there. They had no Tylenol. They were suffering. They were in open air. His family was poor, of course. Next to him were these 2 babies. They were sleeping. They weren't fatalities. You can see his uncle there and some of our staff. But just, you look at that boy, and there were 30,000 of these children. So we went through the day, and one after another, I think actually this house is the same property where the child had died. I believe that was the same area. And this is Nadine and me gowning up, knowing that we didn't actually need to gown up, but we had a discussion because our nurse was uptight, that particular one, though fantastic. And we knew it would make her feel better if we gowned up to give it the immunizations. So there was a lot of interesting, acclimation that we had to undergo. And this is a child that Nadine saw who was quite sick, and they had a terrible conjunctivitis, and of course they had pneumonias that were coming on. But one after another, it was a quick triage, and then a determination whether they had to go immediately to the hospital or not. And so this is what it looked like. This is what it looked like from outside the country. It was quite heroic, but it was tragic for its own period. But then we imagined what this would send as a message. We were not messing up the TMT. We were not messing up the super ferry. We weren't in conflict with one another based on our ethnicity. We weren't wondering whether someone was a Republican this or a Democrat that. We were just out there trying to say Hawaii cares deeply about other people. And in turn, we could tell they cared about us. So this was how we approached our medical mission. Now, a couple take-homes. We were able to do this without a single taxpayer dollar, not one. We were able to do this in one day. Now, if we can do something like this in one day, surely we can figure out payment transformation in the state of Hawaii. Prior authorization. Surely we can figure out ways, if we can get 480 volunteers out to Samoa in a day, we can figure out ways to get scholarships to bring nurse practitioners and family doctors into a beautiful state like Hawaii to be a part of what we think is a medical mission, to live and work in a beautiful place and to go abroad. Surely we can take care of some of those challenges. And that's really what I wanted to impress upon people. For years, we've been coming to conferences with extraordinary minds, but often the same challenges as we kind of come and go. And we wonder, as we compete, as we have discussions between the plans and the independent physician groups, or the hospitals and solo practitioners, as we wonder, how do we navigate and survive in healthcare? It all seems so complicated. And a lot of the times, we still work together at the end of the day, but maybe to the detriment of our healthcare capacity or our abilities to be at our very best. Because if 50 to 60 providers and a few other people that came along can take care of 34,000 people in a crisis in a day, surely we can take care of all the people of Hawaii in a professional, wonderful way. And so I just wanted to end this by saying, thank you, guys. Thank you, because so many of you were the very people that stepped up. These were some of the names that I wanted to make sure I didn't forget, because I would never forget Mufi or Nadine or Chang over at Queens. But I also wanted to make sure that all of these thanks and UNICEF went out. They were just totally amazing. And the future is going to be an extension of this, because we have decided to create the Hawaii Health Corps. And we will be, in the coming months, embedding that in the Healthcare Association, making sure that we have resources to go when needed. We've already been asked to go to Micronesia because they have a dengue outbreak and they're having a bit of trouble. We're going to try to do it right. We made some mistakes, although nothing that wasn't forgivable. And we want to be able to extend these thanks to everybody. And we want Hawaii to continue to lead in a way that made America proud. I can tell you we got a lot of positive feedback from people that I probably shouldn't name that were on the other side of government. They were happy that we went. And certainly the Samoan government and the people all across our community that have ties to Samoa, that have ties to the Philippines, that have relatives that travel extensively throughout the Pacific. So it was absolutely amazing. It's something we'll never forget, and I think it can be a model of success for us as a healthcare community going forward. What we are capable of unites us in a much greater way than what divides us in our day-to-day conversations about healthcare. Thank you very much, guys. It was fabulous.
Good stuff, good stuff. You want to sit or you want to stand?
Yeah, I'll sit.
Yeah?
That's good. It's emotional to see that. I haven't seen a lot of those pictures till today.
I was chatting with your security guys here. This mic's a little sensitive. Some big brawny dudes. And not the guys who are in this room, but last week when we were talking.
Yes.
Talking about little people that didn't make it, and they were choking up. Couldn't help but choke up, obviously, when they were talking about it. Hawaii knows a little bit about Samoa. Most of the country has no idea that there is a place called Samoa, much less that they had a measles outbreak.
Yeah.
How do we inform folks, policymakers, advocates, about science and vaccinations so that we don't have to have a Samoa in a Kansas City or Dallas or Minneapolis or any place else like Chinatown.
I'm glad that is where this conversation's going. So we have to be open with people who have different opinions. There's no question about that. When I was a legislator, I never went all in and told people you have to be immunized, because I knew it would create friction, and I wanted people to get there on their own. But it's my opinion that infectious disease is going to be a much larger problem for us than terrorism, say, going forward. If infectious disease ravaged our state, it would have an economic impact that you wouldn't even be able to fathom. Tourism would dry up. We could lose 2 or 3 months of resources, and that would devastate most of our institutions. And obviously, you can imagine what the impact is on other countries that have less of a reserve than we do. But at the same time, when I have someone who comes and says, I don't want you telling me to be vaccinated, I have to be vaccinated, I'm now telling them, all right, well, I want you to just take a moment and imagine, would you take your children and go with us on a medical mission into Samoa or another country where everyone is infected or everyone is potentially infected without your kid being protected, knowing that there's a 3% chance right off the bat that they're going to get infected and die or come back and infect their whole school? Would you actually do that? Because I think people have to have an honest discussion. We actually live in society. We do share schools and roads and grocery stores. We share a lot. And there's no way around that. Now, people can choose to not be close in society, and I'm sure that somebody could make an argument to spread their vaccinations out. But as we have homeless surges, like in San Diego, where they, I think, had a hepatitis outbreak, right? Mm-hmm. These are things that could really devastate a lot of innocent people, a lot of newborns, obviously, and for gosh sakes, a lot of kids that probably could end up with serious encephalopathies, blindness, deafness. It's just too much to bear. So I think we just put the reality out there, and we tell people, you're just going to have to be a part of society or you're not. And we'll be as fair as we can. I don't know the science as well as some in this room, I'm sure. Perhaps we can be a little bit flexible, but after being in Samoa, I can't tolerate, personally, a dogmatic anti-vaccination standpoint. And I'm told that they're coming to give me grief tomorrow or the next day, and I'm going head-to-head with some of those guys because I saw children pass away that shouldn't have, and I can't take it.
As you know, we are lucky enough to host this in California. We had Senator Richard Pan, who's a physician. He's the chair of the California Senate Committee on Health. And he was a keynote in our San Diego conference in December. What many of you may know or you may have seen that on the last day of the California legislative session, a group of anti-vax folks dumped a small bucket, container, of menstrual blood on the Senate floor and in protest and screamed about killing babies through vaccinations. So when Senator Pan came to state a reform, we had threats. There were protesters outside. We had threats of, implied threats of violence, maybe not. So we had to get a bunch of security folks in the room. Yes. And his argument was essentially, he had passed a bill that essentially said, you don't have to have vaccinations, but if you want to go to public school, you have to have a vaccination. You have to be fully vaccinated, and that the personal exemptions, including religious exemptions and the like, were eliminated. What do you think about that? That's a pretty ambitious activist step, but one taken by a physician leader who's looked to in his policy world for leadership. Do you think that the exemptions which exist should be essentially vacated or mostly vacated in Hawaii, not because of dogma, but because of the experience of places like Samoa?
I think we're going to get there quite quickly. I think people can still make their most compelling case. And we do allow for certain strong ideology. There's no question. But a lot of people do hide also behind pretty soft arguments, yet they expose others to significant injury or death. I think it's, if I'm going to be quite honest, pretty courageous of that legislator, because I was there. I served 4 years in the House and 10 years in the Senate, and if you guys remember, my district was on the Big Island, which wrapped all the way down to the south, where, interestingly, I was the family doc for a bunch of years too. So I was giving immunizations and trying to convince people for years always to get immunizations, but some people wouldn't do it. And there's a large population in the particularly rural areas of Hawaii and Big Island especially, where you don't have 40% of a school, of a charter school, for instance, being immunized. They're going to get creamed. And those kids are going to have pretty significant illness and sequelae. And honestly, at least we have to let people know exactly what's coming. Not to scare people, but to be aware. I do think that given where we are as a country, it won't be long before there are pretty significant mandates. The country is very much a patchwork, though, of ideology, as we know. One state's mandate could be very different in another. And I think it's important that the medical community do its best to allay the fears of people. I was told that a lot of people who are anti-vaccination change their opinion when they're given some more autonomy about the schedule. Now, it still has to be effective, but if we can bring an extra 20 or 30% of the people around, then maybe we're not pushing so hard against an ideologic position. I don't know why anyone would dump menstrual blood on anything. I mean, that sounds excessive.
Yeah.
But, you know, it was interesting. We were in a country that just 6 months before had been anti-vax. And just through confidence and a good professional team, it became completely participating. I mean, how hard can it really be? And I'll tell you, a few tragic cases in a small community, which all of Samoa is a small community, I think informed people very quickly. It was, right as of now, I believe the number of fatalities total is 81. And one of the after stories, which is wonderful, is that it worked, okay? We saw that 7 to 10 days after we vaccinated everyone, before, 4 to 7 deaths per day and at least 100 new cases of measles every day. 7 to 10 days after, the number of cases dropped down to almost nothing, and the fatalities dropped to 1 every 3 days, and then to nothing. So the science actually worked, and I just can't imagine, with, you know, as you know, I've got 2 kids. I can't imagine ever letting them be exposed or them exposing someone else. I just couldn't do that as a person. And so when you start putting on those other perspectives, I think people will get there.
You know, we're getting short on time, and I want to make sure that we let folks go and take on the rest of their day. It strikes me that so let me just ask 1 or 2 more questions, but it strikes me that when I speak with folks who think about and study epidemics, that the most likely vectors or places where this might come from are influenza strain that is beyond our near-term ability to produce vaccinations against, and then it may come from an animal human transmission in a rural country probably, and that we're not ready for that either. Connect that with or when I connect that, just as we're sitting here, to the experience of the ballistic missile threat, when, you know, that was a scary time. We were here, and it happened right after state reform.
Right.
Has Hawaii gotten smarter about the next big existential threats because of the ballistic missile threat, and recognizing that Hawaii will probably be near the precipice of whatever the big epidemic might be? They will get hit before Kansas City, right? So is there thought about becoming better prepared at the community level for something major like an influenza strain?
There is, for sure. I was on call the day we had the missile crisis, so I remember walking down the road in Hawaii and seeing it on my cell phone, and was pretty aware right away that it was, you know, just a scare, because there weren't missiles flying over us, to be frank. We would know that there would be some risks. And now I've been a part of the experience where we were in Samoa, facing outward to avoid infection coming to Hawaii. We now have the capacity to lead this region. We're in discussions with the military to also have their support. We have the CDC on our side. We have the World Health Organization on our side, helping advise us on how to be not just ready, but to actually be leaders into all these other countries. And one of the nice things about being in Hawaii and being a part of the United States, although there's some tough things, of course, too, one of the nice things is there's a certain amount of expectation that we will be professional and we will have capacity with resources to go out. And this was, I think, very eye-opening to a lot of people in Hawaii. We expect to have 300 or 400 members of the Hawaii Health Corps that will be available, from nurse practitioners, like I said, to docs, aides, who will not only go on medical missions abroad, but will do medical missions at home, domestic missions, whether we have a crisis with mental health care, or an outbreak, or a natural disaster which requires access to health care. But also, we will be educators, because part of it will be a curriculum where we get the best practices from all over, where we can go into our communities, and I would expect, because we already had volunteers from all across the state, from all the islands for this medical mission, for us to be able to, when we're not in the throes of a conflict or a crisis, to be able to be health educators. It won't only be infectious disease, although that will be central to what we do, but to help people better understand what the healthcare system is about, what their access issues are, all the very things that we worry about day to day that might not be crisis, but when you add them up and you let time, kind of roll over these health problems that we don't address, they become crises. And that's the power of this crisis, which lit a fire under us and now brought us together. And I expect it to bring us together even tighter. It brought together the hospitals, it brought together the providers, it brought together the plans and the airplanes. I mean, it was really interesting to see people unite so quickly. And I think that can be used to be the best place in the world. Also, our university. We are specially placed for tropical disease to study it and to maybe develop vaccinations. There's so many potentials from this that we hope to see, but please join in. Please become a part of this, because I felt that it was invigorating for people. That's what they told me. I see David over here, who is a dear old friend who's focused on physician burnout for all these years. I heard people say that they shrugged off years of healthcare and physician burnout by having this brief experience, because they felt they were part of something that was dynamic and immediately impactful and interesting. There was no paperwork, by the way, David, at all. There were no EMRs. There was no insurance. It was just care. And that was in some ways the beautiful part of it, as we took care of a bunch of kids.
Lieutenant Governor Josh Green, let's give him a round of applause. Thanks, sir.